Is everyone who's feeling pain that would maybe get a steroid injection, are they good candidates for this, or is somebody more so than others?
Yeah, I think there's nothing wrong with trying one steroid, but I think like most of us, we've been somewhere and we say, okay, that worked, but it wore off and let's do another steroid. And I think some patients go, geez, should we really do another steroid? And the answer is probably not. And so I think, if you've been somewhere and you've had a couple of steroids, or if you're cautious about steroid, there's reasons to kind of hold off on steroids. And I think this is a good treatment to try because it's very safe and it just uses your own tissue rather than using a chemical that you just don't know what's going to do to you long term.
Sure, that makes total sense. And I'm sure the success rates that you're seeing are incredible. Do you have any stories that kind of stand out?
Yeah, I've had patients that said that they needed a knee replacement or they needed surgery or they just weren't a candidate for surgery and they were desperate and they were on painkillers or they were on long-term steroids and they came in and they're now functional. I have one guy who's in his 70s who does 13 triathlons a year and all I've been doing with him is blood shots, is PRP injections for the last decade or so. So I think there's lots of patients that benefit from this and obviously we use it in professional athletes all the time. So why wouldn't it work in people that just want to play golf on the weekend or just want to go for a walk with their family?